Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us. I hope, again, we have a lot of information to go over today, so I'll get right at it and start by saying that because of the progress that we've made over the last not 1 week, 2 weeks, 3 weeks, but going back now for a few months, as that steady progression has occurred, we'll be able to move on to stage 5 of our Back on Track plan. Again, I said last week, Dr. Box articulated all the reasons why, that we felt good about that progress, that we were managing our way through this to mitigate, to slow that spread. And I said the proof was in the pudding, and the numbers continue to track in the right direction. We have more evidence that you'll be able to share later on this hour. As we've done previously, when we've moved one stage to the next, we've done that in 3-week increments to be able to best consume and digest the data that helps guide us on whether to go forward or not. And so we'll do that again, and Dr. Box, you'll get, per usual with the plan of the day, you'll get more into the specifics and take a little bit of deeper dive into the numbers in just a few minutes, but we'll see with our color-coded maps that measures county by county on a weekly basis, both positivity and cases per capita that we are seeing in all of our counties. And the good news is there that when you look at that map, it really does jump out at you. There's a lot more, by far, counties in blue, which is good. That's the color you want to be, and than any other color. And so, again, just kind of further evidence for the jury that we are moving in the right direction. And I just want to take 10 seconds to say thank you, because we don't do this without adjusting our daily lives and our routines and how we interact with one another, how we are physically separating ourselves more than in the normal times, how we're washing our hands, how we're masking up. All those actions have an effect on our overall performance as a state of Indiana, county by county, community by community. And they may sound like the basics, but they're true. And I was reminded by, I just shared with Dr. Box, I was reminded by this fact that my kindergarten teacher, actually yesterday in my take-home mail, sent me a copy of the All I Really Need to Know I Learned in Kindergarten. Thank you, Mrs. McKnight. I remember you as well. And she reminds me on pages 2 and 5, it talks about washing your hands and other items to keep top of mind. And so it's always been the case. And then these practices, these better hygiene practices during a pandemic, they're always important, but even now they're highlighted and heightened in terms of their importance. And so we have to be ever mindful of that if we want to continue to really separate ourselves in terms of comparing to other places around, not just the country, but around the world. We have been very steady Eddie, very methodical about this, very data-driven, and that's how we'll continue to be. Currently, our 7-day positivity rate has hovered around 4%, and it's been holding, steady. It was holding steady in July. It's 6 to 6.5%. So we've come a long way. We don't want to give up that ground that we've advanced on, and we're testing more. On average, about your last report was about 15,000 a day.
15, yes.
Yeah, about 15,000 a day. So that's very helpful too. Tracing is working. As we're talking to folks all over the state of Indiana, we're able to zero in on where a case started. Hopefully you'll scratch at that a little bit more. Our resources, obviously PPE, our healthcare network has been able to absorb the incoming traffic, and in areas where it is ticking up, we're able to accommodate that as well by coming together in terms of ICU beds, et cetera, negative airflow rooms, all the above, all over the state of Indiana. So we've been able to make those adjustments because they haven't been overwhelmed. And you also see maybe a direct or indirect correlation between our livelihoods, our economy, and the health of our citizens, the lives of our citizens. And so we it's probably not too strong of a word, the path that we're on, the direction that we're moving, but we really have to just underscore how important it is for our citizens and our businesses to continue to make those adjustments and operate in a very safe manner. It has a huge impact beyond your kind of personal space. By the way, as I also said last week, and I'll say it again, I know no one wants to wear a face mask. I mean, this is different, especially for Americans and Hoosiers. I get it. It's not my preference either, but it's not my preference that the pandemic is on top of us either and follows us around. And while our numbers are tracking in the right direction, enabling us to further open up, it's because of this. And hopefully you'll talk a little bit more about that as well. We often hear, because we get out and about, whether it's physically or on the phone with local communities and local leaders all over the state as a state administration, and sometimes we hear, we've talked about this, but sometimes we hear that, that's really, COVID-19 really affects urban areas or just the highly densely populated areas of our state, or the areas that are, really have a large amount of congregate living. Not true if you look at the numbers. Certainly, we're talking about rates, I guess, and certainly what we're seeing, whether you're in Noble or Davies or Montgomery counties, maybe not as populated. Folks are not just spreading, and that's all counties. I'm not just singling out 3 of 92, but it's not just spreading, but we're losing lives there too. And so we want to make sure we're doing all those little things, quite frankly, that add up to make a big, big, big difference. And today's positivity rate, again, proof. I mean, we're under 4%. And that's something that maybe 4 weeks, 8 weeks ago,
We weren't sure we would get there,
yeah,
sir.
Yeah, exactly. But we took some actions, and that has made maybe all the difference in the world for many people. So thank you. I mean, a lot of credit goes out to all those folks that we're talking to every single day that say we've put in the proper protocol, whether it's at work, we have physical distance between us. If we're around other folks, we've got our mask on. We have different schedules, really creative measures being implemented right now all over the state of Indiana. And again, it just adds up. So thank you. And if you go to the website, you look at stage 5, it's all there, probably in blue and yellow. I was going to say black and white, but it's all there, posted for your consumption. It will all be updated by tomorrow, close of business. And it will go into effect, obviously, on Saturday. So this current phase sunsets, if you will, on Friday. So Saturday morning, it will kick in, stage 5. So just wanted to, not just foreshadow, but help people prepare for that. What that actually means, again, you'll be able to see that on the website, word for word. But that means that we're removing all the size limitations on social gatherings. If an event is over 500, we're still asking folks to go to your local health department to get sign off on your plan. This has been the case, this has been happening, but we've had a lower threat, we've had a restriction on that size gathering. That's no longer in effect. We have proven effectively, whether it be at schools or businesses, that you can operate safely and manage your interaction, whether at work or at school, and that's the key going forward as well. That also means very specifically restaurants and bars that serve food may be open at full capacity, again with those physical distant measures put in place. Those haven't changed. It's just those capacity levels have been lifted. So bars and nightclubs with seated customers, whether at the counter or at a table, indoor and outdoor venues may open at full capacity, but again with those precautions in place. Senior centers and congregate meal sites may be open with all the precautions. Personal services, think gyms, fitness centers may resume their normal operations, again with those physical or social distancing safeguards, and all the cleaning protocols need to be in place. Stage 5 has been adjusted slightly from where we were 6 months ago. Probably when we first rolled this out, it was probably about 6 months ago. As we were contemplating what these different stage 1, 2, 3, 4, 5 would look like if we were managing our way through this. Realistically, I understand, I get it, that because of what I just said, not every establishment will be able to operate at what was their previous full capacity because of that physical distancing and social distancing that must occur. Again, what's been one of the key efforts that has translated into our progress. So we want to continue doing those things and protect against the spread of this virus. And so we're going to continue to observe all those. Removing the capacity limits, it is progress. Just to underscore that again, I sound like a broken record, I get it, but it is the reason that we're able to make this progress. So we'll continue to monitor all the data. We'll continue to use our color-coded map approach to track the prevalence of COVID-19 throughout the entire state, all 92 counties. Dr. Box and her team will maintain communication with public health officials in every single county in monitoring all of the positivity rates, and then make recommendations and collaborate with the local communities on steps that they can take if cases start to tick up, and make sure that we can reverse those, as we've been doing for the last 6 to 8 months. The executive order, obviously, again, posted by COB tomorrow, and then we're obviously here to answer any and all questions. Also, with that out of the way, and before we get to Dr. Box and her report, we're also joined by Higher Education Commissioner Teresa Lubbers is with us, and she's going to give an update on the Rapid Recovery Workforce and Employer Training Grants. And then Chris Johnston will also give us a brief update on our CARES Act dollars, and then we'll get to Dr. Box. Teresa.
Thank you, Governor. As you know so well, we've been laser focused in Indiana on the health and the economic recovery and the well-being of Hoosiers. We really feel in Indiana we've been uniquely prepared to address the economic issues that were accelerated because of COVID-19. There are many reasons why. I'd like to cite just a couple. The creation of the Next Level Jobs program in 2017, which included the Workforce Ready Grant and the Employer Training Grant, has a focus on getting the unemployed or the underemployed Hoosiers the training they need for a good job. The creation of the Governor's Workforce Cabinet in 2018 really aligns Indiana's workforce and education programs, our funding, our policies, our programs around personal prosperity, meeting the needs of employers, and of course, building a stronger state economy as well. Earlier this summer, Governor, you tasked a group of state leaders to develop a plan to help Hoosiers get on the path to education and training and to get a new or a better job in the wake of COVID-19. We call this work Rapid Recovery for a Better Future. The plan is really focused around people, with an on-the-ground approach to meeting Hoosiers where they are and helping them take their next step to a better future. We've used the bulk of the original allocation of $50 million in federal CARES dollars to quickly help Indiana scale up these programs, our Next Level Job programs. We were able to use that money to expand the number of tuition-free, high-quality certificates, as well as the number of Hoosiers who were eligible to access those short-term education and training opportunities. Today, I'm pleased to announce the results of the expansion and as well announce the injection of another $25 million in federal funding for Indiana to continue this very important work. We're making progress. Unemployment is down in Indiana. August unemployment rates showed Indiana at 6.4% compared to a national rate of 8.4%. Since June alone, 3 months ago, over 5,500 Hoosiers have used the Workforce Ready Grant to enroll in classes or training. More than 2,800 Hoosiers have completed the Next Level Jobs program, the Workforce Ready Grant, getting them a certificate during this 3-month period. And we know that Hoosiers who complete a Workforce Ready Grant see results in their own lives. Since the creation of the program in 2017, over 16,000 Hoosiers have completed a Workforce Ready Grant with a median annual income gain of $6,400, and nearly 3,200 Hoosiers are currently enrolled. Likewise, the Employer Training Grant has seen tremendous results, with over 7,300 employees trained with the grants since June. This includes over 3,000 new hires, as well as hiring people on to do new skills at the same time. The individuals are being trained to fill high-demand jobs with an average wage of over $20 an hour. Since the creation of that program in 2017, over 1,500 employers have used the grant to train nearly 19,000 people. With this additional $25 million, even more Hoosiers will be able to take advantage of the free training through December 30th of this year. While Next Level Jobs will certainly continue after that deadline, the extended opportunities funded with the CARES dollars may not be available after December 31st. There's still time to enroll this year and earn education and training. Ivy Tech is enrolling for the second 8-week courses right now, and Vincennes, the university, and other eligible training providers are ready to provide training as well. Go to nextleveljobs.org to get connected to one of the training providers. We know that during this time, Black and Hispanic Hoosiers, as well as those in rural communities, have been disproportionately impacted by the economic impacts of COVID-19. You tasked all of us involved in education and workforce to find ways to ensure Indiana's available opportunities are reaching these populations. And I'm pleased to report today some positive results with our Next Level Jobs programs. The results of our Employer Training Grant. Indiana has significantly increased the participation among minority, women, and veteran-owned businesses during this phase of rapid recovery. 17% of employers receiving the employer training grant during this time are minority, women, and veteran-owned businesses, and the outreach is continuing. The results of the Workforce Ready grant. The Commission, tomorrow in fact, will issue our 2020 Equity Report, and we will report that enrollments among Black Hoosiers in the Workforce Ready grant during our last year of data are at a higher percentage than the Indiana's Black population overall, 15% enrollments compared to a population of 9%. So we're seeing positive results from these workforce and economic efforts, but there are still thousands of more Hoosiers who need access to affordable education and training to get them the jobs that they need. With the additional $25 million in funding that we've announced today, we can continue to help Hoosiers skill up or get a better job. I encourage all Hoosiers to take the next step to further their education and training. Now is the time. And as we say, and we mean it, Indiana has your back so you can move forward. Thank you, Governor.
What a great report. Thank you, Commissioner Lovers. I'm going to call an audible and not call Chris, O&B Director. I'm going to go right to Dr. Box. But before I do, I just wanted to underscore, maybe you'll get at this as well, but the Fairbanks Public Health Study is in round 3. It's coming out there, coming out soon.
Starting next week.
Next week. So if you get contacted, please participate, because this helps us to the extent that we can look out a distance, and helps us know what's going on in all of the populations in our state.
For the first time, we'll be able to see some prevalence in kids.
And kids, and this is round 3, so we're just layering on more and more, data to access. So with that, I'll turn it over to you.
Thank you, Governor. Good afternoon, Hoosiers. First of all, I want to expand a little bit on what the governor was saying about why we're so committed to Hoosiers wearing masks, not only to protect themselves, but to protect others. In the beginning, we didn't know a lot about this virus, and we're still learning every day. But through watching the spread worldwide, and through our contact tracing, through our Fairbanks study, and through multiple evidence-based studies and plenty of real-life examples, there's really ample evidence now that people without symptoms can definitely spread this infection. And that has been one of the greatest challenges with this pandemic. Wearing masks is one of the many steps that can help prevent that spread. We know that the primary way that this virus is spread is through respiratory droplets when a person exhales, because they're talking, laughing, singing, coughing, sneezing, whatever that is. Sometimes the smaller particles can even remain suspended in the air and are considered aerosolized. Cloth face coverings have been shown to substantially limit the spread of exhaled respiratory droplets, and they may prevent the inhalation of infected particles suspended in the air from another individual. This should not be a surprise to us, but because masks have been worn in the healthcare settings to prevent the spread of respiratory viruses for years. We also wear masks in surgery to prevent infecting a patient who's undergoing surgery. In a recent study, frontline healthcare workers who have a much higher exposure to COVID-19 had a similar rate of infection from this virus as the general public, even though we would have expected their rates to be much higher because of their regular exposures. The lower infection rate was partly due to the universal use of masks in the healthcare setting. Masks should be used as a part of a comprehensive strategy to suppress the spread of COVID-19 virus. Let's look at just one data point, the positivity rate. Certainly, there are other factors at play. For example, schools have reopened and students have returned to college campuses. But these charts show the positivity rate in the state and in 2 specific counties that enacted their own local mask mandate in advance of the state-required mandate. Elkhart County put its own face recovering requirement into effect on June 30th, when the positivity rate was 9.8%. As of September 16th, the positivity rate is 5.8% in Elkhart County. Let's take a look at Marion County. The positivity rate was 6.4% on July 9th, when the county mask requirement began. On September 16th, that rate has fallen to 4.9%. And for the state overall, the 7-day positivity rate in Indiana is now 3.9%, down from 6.4% when the mask mandate went into effect in late July. I know all of you are tired of me messaging the importance of these mitigation strategies, like washing your hands and social distancing, not coming to work or school if you're sick, and if you are sick, getting tested, and then helping our contact tracers to reach out when they reach out to you so that we can stop the spread of this infection. But these are the measures that we can use to help us control the spread of COVID-19. And this is a must in order for us to be able to save lives and keep Indiana open. These are the measures that have allowed us to open our businesses, to allow visitations in our long-term care facilities, and enable 94% of our schools to be open with at least some in-person instruction. Essentially, this is what's helped us to get to stage 5, so that we can get back to doing the things that we enjoy, still with some guardrails in place. Examining the data has also helped us get to this point. Today, we reported 728 additional cases of COVID-19 in Indiana, which brings our total to 1,113,337, the total number of Hoosiers known to have COVID. We also saw 10 additional confirmed deaths. To date, 3,305 Hoosiers have died of COVID-19, and another 225 are believed to have died from this disease based on their clinical diagnosis. As of September 22nd, 815 Hoosiers were hospitalized with COVID or COVID-related symptoms. The number of patients admitted each day stood at 51 on September 16th, which is down from 87 in late July. As I said earlier, our 7-day positivity rate for total individuals tested is running below 4%, while our cumulative positivity rate is 6%. The positivity rate is encouraging as we move into stage 5, and you can see that reflected in our color-coded map. We have a lot more blue counties. That means that the percent positivity in those counties is below 5%. Today's map shows just 2 counties in orange, and those are Monroe and Gibson. Gibson is due to an outbreak in a congregate living setting. At this point, we believe about 65% of Monroe County cases are on the college age group. But this map doesn't mean we are out of the woods. All it takes is one outbreak or a group of people who don't wear masks or don't practice social distancing, and those numbers can spike quickly. So as we move into stage 5, it's absolutely imperative that we remember that this is not a return to life the way we knew it in January or February. We continue to look at data from our partners at Regenstrief, who have reviewed now 106,303 cases to date. Of those, about 21% visited the emergency department, which is consistent with what we've seen in the last few weeks. A total of 12,265 people were hospitalized, which represents 12% of all positive cases and is holding steady. Of those who were hospitalized, 20% were admitted to the ICU. That represents 2% of all of our positive patients. Those numbers are consistent with what we saw last week. 76% of hospitalized patients have been discharged. Of the remaining 24%, 6% are believed to still be hospitalized, and 18% are known to have died while they were hospitalized. Regenstrief also estimates that 84% of patients have recovered, which is a slight increase from last week. We will continue to gather and report out data going forward. In that spirit, I want to share our first historical snapshot, and I want to say historical and snapshot so that you know that this is just a snapshot in time of school data to give you an idea of what our school dashboard is going to look like when it's complete. This dashboard will look a lot like our long-term care dashboard. Schools have been entering the historical data into our portal since last Friday. So far, we've received data from about 2,000 schools, over 70% of our schools. We know that there are others that are still submitting data, and we want to ensure that every school can do this. So if you haven't heard from us, please, to get access to this portal, contact us. So what you saw there was basically the portal as you'll see it when it first comes up. It will show you new student cases, new teacher and new staff cases. It'll show you total positive student cases and teacher and staff cases. You'll also be able to filter by your school system or your school so that you can look at your individual school. You'll also be able to look at a map where all the positive cases in schools have been reported across the state, and it also shows all schools. And then when you do filter based on your school, you'll be able to see, if you toggle from the students to teachers to staff, the number of cases and the dates that those cases were assigned. Also, the statewide student demographics and teacher and faculty demographics will be there, but that will be a statewide number and not school by school, just based on the confidentiality process. While we are focused on schools, I want to briefly highlight that some of the work that's been done to address food insecurity across the state. Our efforts started by focusing on school children, but throughout the pandemic, hunger relief networks, food support programs like SNAP and WIC, and the philanthropy and business community have come together to support all Hoosiers who are experiencing food insecurity. These efforts include the use of pandemic electronic benefits transfer cards, which moved the funding for free and reduced lunch given in schools to a SNAP card for families and children. Indiana mailed out 600,000 EBT cards to students and has provided $188 million in food benefits as part of this effort. We now have the opportunity to repeat this program for the first 2 months of the fall semester for children who are in virtual school environments or at home isolating or in quarantine. This is in addition to the USDA waiver that allows free meals on-site or for pickup at schools. All Indiana schools received an email with instructions on how to submit this data. Being hungry should not be another worry during these times. So I encourage you to participate so that we can make sure that all children that are completely virtual or even partly virtual receive these benefits. I also want to encourage, as the governor said, all Hoosiers to participate in Phase 3 of IU Fairbanks School Prevalence Study. This is the first prevalence study that looks at children age 5 and up, as well as adults, and gives us an opportunity to better understand how COVID impacts children and transmission rates. About 30,000 Hoosiers across the state should have received postcards saying that they were randomly selected to participate in the study. We're also sending separate postcards to people who previously tested positive so that they complete a survey. The prevalence study begins Tuesday and runs through October 3rd, and we will have some supplemental sites on October 4th and 5th to ensure we are including Hoosiers from all corners of the state who represent our most diverse populations. Please get tested as a part of this study. Your participating in this is critical to informing our understanding of how COVID works, spreads, and who it affects, and how widespread the infections have been. I also want to remind Hoosiers that getting a flu shot is more important than ever this year. Each year, thousands of Hoosiers are diagnosed with the flu, and unfortunately, some Hoosiers die. The flu and COVID have a number of symptoms in common, and both are respiratory illnesses that can lead to severe complications that require hospitalization, the use of ICU beds, and sometimes ventilators. Our healthcare systems have worked tirelessly throughout this pandemic to ensure that they have enough critical care beds and equipment to handle the potential surge of COVID cases. While we have been fortunate not to overwhelm our healthcare system so far, flu season could be a game changer. So please get a flu shot. It takes about 2 weeks for the shot to take full effect, so now is a perfect time to get your vaccine. Other vaccines are also important as we try to keep Hoosiers as healthy as possible amid this pandemic. To help with this, I'll be issuing a standing order that allows pharmacists to administer to adults the vaccines that are recommended by the Advisory Committee on Immunization Practices. This expands on the federal HHS directive that allows pharmacists to immunize children ages 3 to 18 and will help increase access to care throughout our state. Keeping Indiana on the right track takes all of us working together. Thank you, Hoosiers, for doing your part.
Thank you. And before we go to the Q&A, Chris, you want to give us an update on some CARES Act dollar allocation and just general updates?
Sure. Good afternoon, Hoosiers. My name is Chris Johnston. I work at the Office of Management and Budget. And the recovery team continues to review existing and potential programs to help Hoosiers across the state. And part of that review is looking at what's successful as far as those programs. And you heard from Teresa Lubbers earlier, a successful program for the Workforce Ready Grant as well as the Employer Training Grant. And we have the opportunity to supplement those activities with additional funds. On the sort of other end of the spectrum, we are making adjustments, and earlier this afternoon, the Indiana Economic Development Corporation announced some changes to their Small Business Restart Program. That program, in many programs that the recovery team is looking at, is trying to be complementary or fill gaps that we think might be out there for Hoosiers with the federal programs. There are a lot of federal assistance programs that have been put forth, and this is one of those, the small business program. And one of the features in the program is that if you were receiving the Paycheck Protection Program assistance, you are not eligible for the IEDC Small Business Restart Program. We think that now that the PPP, the Paycheck Protection Program, has terminated, that might be an opportunity to still fill some of those gaps for Hoosier small businesses. We think, in fact, that requirement that you could not have received federal assistance may have been a limiting factor as far as the participation in that program. So those changes have been promulgated this afternoon. Another program that's being evaluated is with our Indiana Department of Agriculture, looking at the security of the food supply chain with small meat processing plants and looking at opportunities to maintain and expand the capacity for that food chain. Some other updates, Governor, is remember the Arts and Cultural Events Support Grant Program. The Indiana Destination Development Corporation and Arts Commission have received several hundred applications, and those are in the process of being evaluated and awarded. We've had visits from Jake Sept at the Housing and Community Development Authority several times on the rent assistance, and as of last week, over $20 million of assistance has been provided, and the processing of those applications continue. And then finally, related to the Coronavirus Relief Fund, we have the $300 million program for local units of government. And we've been waiting on additional guidance from the U.S. Treasury, and that has been received and adds clarity to how that money can be used. And so we've been in communication with the municipal and the county organizations about changes to those programs, and received a favorable response on that, and we'll be moving on that in the next week or so. And then finally, in addition to the Coronavirus Relief Fund, which I just mentioned several programs that are funded by that, there are about 36 supplemental grants that about a dozen state agencies are administering, and those have all really ramped up, and the spending on those programs, ranging from housing to education to congregate meals for the Division of Aging at FSSA, are all in process and moving forward.
Thank you, Chris. Rachel, let's go to Q&A.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Good afternoon. I have two quick questions. The first is on the absentee mail-in voting issue. We are now one of 4 states that have not freed it up to allow all Hoosiers to vote that way this fall. I'm trying to understand why that has become such a line in the sand for you. And then my second question for both you and Dr. Box is, tell us a little bit about what you guys are doing personally in the state now. In other words, are you going to restaurants to eat? Are you getting your hair done in salons, going out of state for travel, that kind of thing?
Great question.
Tell me where you get your hair done.
I always get my hair done, sir. That's top priority. I do. I've been out for my anniversary to a restaurant and enjoyed that. I tend to spend a lot of time at home with my family, and we really that's our social bubble that we get together. Do make sure that I get out and get my exercise on a regular basis and try to spend most time outside. So yeah, I am getting out, but I'm always wearing my mask. I'm always careful about that, not just because I want to set a good example, but because of my age, and I just want to make sure that I'm protecting myself and other individuals around me.
The second question, I would say, yes, I've done the same. We believe that it's safe to eat out at restaurants. Obviously, the market speaks, and the safer that the establishment is, that it tends to draw more people. I've been out and about all over the state of Indiana and have been flat out impressed by the new protocol that's put into place. And I could give you a long list. I've said this before, I never miss a meal. I can vouch at so many restaurants and diners that are going way up and beyond to make sure that you have a very high confidence level that it's safe to eat there. So we need to do, if you don't feel personally like eating out, you can still order out, you can still do pickup, you should still, if you can, over-tip during these times. The hospitality and the restaurant sectors have been whacked hard by this, obviously. And so this is another area where we can step up and try to help entrepreneurs get to the other side of this as well. Yes, I don't cut my own hair. I'm a great clips kind of guy. I sometimes just pull off. A few days ago, it was in Columbus. And I was masked up, and they did you can be the judge of it, but it was a crime scene before I went in, and now it looks a lot better. So yeah, I mean, I try to lead by example. I try to mask up. I try to carry on smartly with the plan of the day. If fourth graders can do it, if kindergartners can do it, I'm pretty sure we all can. It's not a line in the sand, Nikki. The first question that you had, it's part of the process. We are not in a stay-at-home posture anymore. When we were contemplating this with the primary election, obviously that was a different scenario. We're at stage 5. There are no restrictions. If you can go stand in line at a B&B, if you can go stand in line to get your hair cut, if you can go stand in line to get your spaghetti, then you probably can stand in line to vote. And that option is actually preferred by a whole lot of people. Now, there are multiple ways that if you don't feel, if you are confined to your home, if you are ill, if you are caring for someone who's confined, if you are away from your voting precinct or site, then you can vote absentee. You can also vote 20 days early. So for me, the options are there and plentiful. And by the way, the General Assembly has a lot to say about how much we expand our voting. So this is a conversation that is legit and should be brought up when the General Assembly comes back, because obviously the Election Commission thought the same.
Julie from the Republic Columbus.
Good afternoon, Julie.
Good afternoon, Governor and Dr. Box. Thanks for taking my question. This is actually a reader's question that I was asked to pass along, and I hope you can provide some information on it. When an individual with a positive COVID-19 test goes in, are they allowed to get repeat tests, and are these repeat tests included in the daily totals? We've had several people allege that people are getting they've tested positive and then get another test after that. I don't know why they would do that, but asking for a reader.
But it's a good question. You know, early on, the CDC recommended that if you tested positive, you did your 10 days, you felt better, your fever's gone for 48 hours, the way to kind of get back to normal life was to get retested again. But what we found is that people, even though they're not infective, still may have viral genetic material there in their nasopharyngeal area, so they continue to test positive for a long time. So the CDC has really gone away from retesting individuals. I do see a group of people that keep retesting themselves, I think, hoping that it comes back negative. But realistically, our antigen tests, even though they may have a higher false negative rate, they're positive. They're usually correct, especially if you're symptomatic. And if it's a PCR test, which is, you know, the kind of the gold standard, that's positive. And we really need you to act on that test.
Kayla Sullivan, Fox 59.
Good afternoon.
Good afternoon. I have two questions. My first one deals with bars and restaurants that have filed a lawsuit against the Indianapolis Mayor Hogsett and the Marion County Public Health Department. They say local government has forced business closures and restrictions, put owners on their families on the brink of financial ruin. They believe there's a disconnect between state guidance and rules for Marion County. Do you believe Indianapolis should loosen restrictions on bars and nightclubs like other counties, especially now that we are moving to stage 5?
Well, speak for myself here. I think we've been very clear, Kayla, about our guidance. If there's a disconnect, we're happy to address it with any county. You referenced Marion County, but we'll continue to remain in the position where we respect local communities responding to the local conditions on the ground there. And they can be, and I support, they having the option to be more stringent in this area as well. But we believe that we have provided very clear guidance on how to operate at this point at stage 5. Want to add anything to the restaurant and bars?
I agree. I think what I would say is that Marion County, like our other counties across the state, follow their data very carefully and look at that also on a daily basis. And they're making decisions that they think are safest and best for their communities.
And then my second,
Yep.
my second question, do you believe the public, press, and lobbyists should be allowed in the room for hearings and on the floor at the State House next session, especially if we are still in stage 5 by then? Why or why not? And will you make sure that all lawmakers wear a mask inside the State House once session starts?
Well, I'm planning on, Kayla, sitting down with leadership at some point to find out exactly where and how they will be meeting. And absolutely, the public needs to be have access to the discussions and the process. So to be determined on how to accomplish that. Obviously, we're doing a lot of things differently. We've had to. But the process needs to continue, and the public is part of this is the people's house. So while they may, I don't want to speak for them, they get to determine that. That's their jurisdiction. So you really need to ask them. But we'll continue to make sure that we're very transparent and accessible on any question that comes through the administration, and we'll continue to work with our legislative partners and members and leaders on how best to get through the pandemic. Should it be different than it is today?
Rob Burgess with the Wabash Plain Dealer.
Afternoon, Rob.
I had 2 questions. First of all, for Dr. Box, over the past few days, I've noticed several instances of new cases being added to Wabash County's total, but the total itself not being consistent with those numbers. For example, yesterday it was at 261, and today it's at 262, but it says 2 cases were added since yesterday. What is the reason for that disparity? I know that there was a lab error that was corrected for several days ago, but I thought that had already been taken care of, so I was just checking to see what that was about.
So Rob, I can't speak to that specifically, but what I can say is we're happy to put you in connection with our data team so that they can tell you exactly what happened on what days. But what we have said all along is that by putting these cases on as quickly as we possibly can, there will be times when we have to go back and subtract and or add cases. And that's just the nature of doing this on an every 24-hour basis. But happy if you want to contact me, we can put you in with our data team and see if we can be more specific about that for you.
Okay, great. And then I don't know if Brigadier General Lyles is available, but Second Harvest Food Bank has announced that the National Guard support that they've been receiving will be ending at the end of this month. The need has not decreased, and they're suddenly in need of volunteers. Why is this deployment ending, even though the increased demand has not subsided?
He is here.
Yeah, I
He was
am.
beamed up.
Thank you for the question, General Lyles, the Adjutant General, Indiana National Guard. So we are not ending the mission in total. We've done an analysis of the food banks that require continued support, and we want to continue to support them. Where we have determined that as the volunteers have come back, for example, in Lafayette and other places, we will end the mission there.
Eric Berman.
Before we move on, I just want not to pander to Rob, but say thank you for paying attention to, he said 261, there was a discrepancy between 261 and 262. In 92 counties with over 113,000 positive cases, presumptive and confirmed, thank you for paying attention to a single discrepancy. And we will get to the bottom of it, actually. We're already scurrying about trying to figure out where that came from. But that's what we need everywhere, that type of not just observation, but following up, engagement, exactly, from certainly the press, the public, and this, you just reminded me, Rob, that we don't get to stage 5 without a whole lot of collaboration, meaning government for sure, local and state and federal, our federal partners, with the nonprofit sector, and with the private sector, quite frankly. We ought to be real proud to be Hoosiers in this state, to have the biotech community, the life sciences community, the hospitals that we have, world-class personnel and resources. When you think about where we are compared to a lot of other states, when you think about folks who stepped up very early, again, all of our hospitals, IU Health came out we had every hospital CEO, in Central Indiana sitting in this room at the very beginning saying, how are we going to deal with this differently? How are we going to become one hospital? Across the whole state in our 12 different health districts, when you layer on top of that Roche, when you layer on top of that Zotec, when you layer on top of that all the Fairbanks, public health study, and everyone that has really stepped up to help us test and trace and properly resource, long-term care facilities all over the state of Indiana. We don't get here by accident. We got here by working together and collaborating, and we're real fortunate. There's probably 49 other states that wish they had the corporate leadership that's so committed, along with our personal actions, and all the nonprofits that step forward. That question about, food banks and pantries. We've come together like no other time. Sorry, I was filibustering there.
Eric Berman,
Yep.
WIBC.
Sorry, Eric, for my soapbox.
I think you and Rachel have figured out that I need time to remember to unmute. So
You're welcome.
My question is about stage 5. You said this runs for 3 weeks through October 17th, and you mentioned sort of in passing that there's always the possibility of rolling that back if warranted. We've never rolled back to this point. We've held on occasion.
Yeah.
We've never reversed anything.
Yeah.
If that were to happen, what are the logistical challenges of doing that, and what are the compliance challenges in saying, sorry, we've got to move backwards?
Well, could be a long list, I guess. But look, Eric, we approach every day by pretty simply, actually. We address all the challenges that are out there. We address assign solutions, action steps to address those challenges, and then we hold ourselves accountable. We measure whether it's working or not. We look at the data. We let the data drive us. And so if a challenge could come up, and by the way, I just never would have thought today, 3.8% positivity rate. I just never would have thought that. Considering what's going on around us, we're moving in the right direction. But I'm going to be faithful to observing and following the data and the professionals in this space. And so if something changes in the future, for the better or worse, we have to make adjustments as well. We just have to. We have to be loyal to that, the data that's driving all of our decisions. And by the way, I didn't mention Catalent, a Hoosier company, who's partnering with other companies on vaccines. So when you start to talk about 3 weeks or 3 months from now with therapeutics, with different therapies that are coming online, Eli Lilly again, working on some treatments, we could be in a different place 3 months from now, 6 months, or we better be 6 months from now, a year from now. But it will still require the same vigilance. And until we get to that point to where we're on the other side, and by the way, and you could dwell on this a lot more, as it gets cooler, as it gets colder, as people start to spend more and more time inside, closer, then that is what many are pointing to say this is where numbers start to spike up. But you mentioned to me earlier this morning, our flu cases right now are lower, at least initially. That's still very early.
Lots of respiratory things are down if you talk to our emergency room physicians.
Right, and again, that's got probably a lot to do with
And washing our hands.
Yeah, and so this is something that you mentioned around the world, different practices, and in Southeast Asia, they're used to masking up when flu season's coming on, and their rates are a lot lower than ours are here in America. So it's working.
Mark with the Terre Haute Tribune Star.
Afternoon, Mark.
Good afternoon, Governor. Thanks for your time. Appreciate it.
Sure.
In the conversation about the polls, how confident are you, given that mask wearing has become somewhat of a political statement, that people going into the polls can know that those that are around them and in line
Yeah.
might be following the mask mandate?
Yeah. I am confident because we pulled off a successful, because of, again, volunteers all across the state of Indiana and the leadership of county clerks and the Secretary of State, Connie Lawson, making sure that they're properly resourced, and our federal partners, again, all coming together. We've seen this movie before. You're right. Some people don't subscribe to the notion that masks slow down respiratory air droplets transmission, and maybe never will. But that doesn't mean that we won't continue to do our job and make sure that they are safe locations to vote. We've done it before. We'll do it again. They'll have the resources, already have the resources to accommodate safe and secure elections.
Andrew Smith, WRTV.
Andrew, how are you?
Hey, good afternoon. My question is for Dr. Box and Governor Holcomb, if you want to add anything.
Sure.
But the CDC just released some guidance this week on Halloween activities. And I know last week, Dr. Box, you said it would be up to the local health departments. Is there any updates as far as what the state plans to do, or if they're going to release any additional guidance?
We will talk more about that next week, but I did have a chance to review their guidelines, and I really like their guidelines. The very nice thing about that, what they do is they break that down into what are the very low-risk activities you could do as a family, the more moderate-risk activities, and the higher-risk activities. And therefore, every family can decide based on who's living at home with them and the health of the individuals that live in their home. As long as you're looking at what your own local health, public health, and elected officials are saying about it. You also want to look at the spread in your own community. So I think there's some really good things in there, and we will talk a little bit more about that next week.
Sierra with Wayne TV.
Good afternoon, Sierra.
Good afternoon. How is everyone?
Pretty good.
Thank you.
Good day.
So we've talked with superintendents and teachers in Allen County, and they are feeling overwhelmed, sometimes working 12-plus hour days. They've suggested 2-hour delays or work days without kids to catch up on work, and they're asking the state for help. Is this something you're looking into or even considering?
First, I've heard of that. Happy to dig into it.
Heard that mentioned
Okay.
before on some phone calls, but that's a little out of my wheelhouse, sir. So I don't know if Katie wants to comment on that or if you want to take that.
Hello, Katie Jenner, Senior Education Advisor to the Governor. You know, we continue to partner closely with our superintendents, principals, teachers, and on this one, I'll make sure right after this and circle with our Allen County superintendents and learn more about this request. Thank you.
Follow with the Superintendent Association as well.
Yeah,
just
absolutely.
In general, just to get a more global.
Thanks for the question.
Thank you, Sierra.
Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon. In departure from my normal, I actually have a couple of follow-ups from fellow reporters. One, I wanted to actually see if we could get you to comment on whether or not lawmakers will be required to wear masks when they're inside the building for the session. And then I have a second question.
They rule their own roost.
Okay. And for the second question, as we move into stage 5, what are you reconsidering, since things are going, well, and our positive rates are going down, reopening certain cabinet members to one-on-one interviews? Are you considering decreasing these press conferences? What's that look like for the digital press room moving forward?
I would, we're talking about that right now, Whitney. I'll continue to be accessible out and about, whether it's here on a regular basis. I do want to make sure that we're, in terms of COVID-19, supplying the public with the latest information and the latest guidance that we have. But we are evaluating, obviously, Dr. Box, scheduled us for 2:30 next Wednesday earlier today, she announced. So we'll be here next, but we anticipate being available on a regular basis just to keep the public updated. How we do that may change in the future because we're in stage 5 and those capacity levels have been lifted. But we'll reserve the right to call a press conference, whether it's in person, just like we do when I'm out and about around the state of Indiana right now.
Our final question is from Erica Washington. Our final question is from Erica Washington with Chalkbeat.
Afternoon, Erica.
Afternoon. I hope you can hear me. So I wanted to know, when will the dashboard, the school COVID-19 dashboard, be public exactly?
Yeah.
So we expect that by the end of the month, so I'm hoping right around the 30th, you'll see that active.
Okay, and how can you follow up from that? How will you ensure that all schools input their data?
I think that will be a work in process like we did with the long-term care facilities. It took several of them a while to kind of get onto the reporting and get into the portal and start doing that. So on the 30th, I would not be expecting that every school will have reported at that point in time, but we'll continue to work with schools across our state to make sure that that data is available.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.